Hi, and welcome to today's documentation compliance tip. This is the Home Health Part 1 documentation of the required face-to-face encounter. The start of care for initial home health certification must include documentation of a face-to-face encounter between the provider and the patient. The FTF encounter must be related to the primary reason for the home care admission. This requirement is a condition of payment from Medicare. Without a complete initial certification, there cannot be subsequent episodes, and the claims may be denied if the FTF documentation is not completed. The face-to-face encounter must occur within 90 days prior to the start of care or 30 days after the start of care. The FTF documentation must show that the encounter occurred within this time frame. The face-to-face encounter must be performed by the certifying physician or provider who cared for the patient in an acute or post-acute facility directly prior to being admitted to home health, and who had privileges at the facility, or a qualified non-physician practitioner, or NPP, working in conjunction with the certifying physician. A non-physician provider, or NPP, in an acute or post-acute facility from which the patient was directly admitted to home health is able to perform this encounter in collaboration with or under the supervision of the physician who had privileges and cared for the patient in the facility. Only the certifying physician can attest to the date of the encounter on either the certification or a signed addendum to the certification. Documentation can be written in the patient's record, either located at the provider's office or the facility caring for the patient prior to admission to home health. There are particular documentation requirements needed for a patient to be eligible for Medicare coverage of home health services. Let's go to the next slide for the list of criteria. These requirements must be recorded in the patient's face-to-face encounter. Confined to the home, under the care of a physician, the need or reason for skilled nursing care, physical therapy, speech therapy, or a need for occupational therapy, and a documented plan of care written by the physician periodically reviewed by the same physician. The home health agency's generated medical record documentation by itself is not sufficient. The home health agency's admission summary, OASIS, and other records supporting certification must be signed by the certifying physician and incorporated into the physician or facility's medical records to help support the FTF encounter. Get the dates of service correct. Documentation must correspond to the dates of service being billed and not contradict the certifying physician's or the care facility's own documentation or medical record entries. The clinical note is most often found as a progress note or can be in the discharge summary. The encounter must demonstrate that it occurred within the appropriate time frame, related to the primary reason the patient requires home health services, and that it was performed by an allowed provider type. As the billing entity, it is the responsibility of the home health agency to facilitate and coordinate between patient and physician to ensure the face-to-face occurs timely, ensure all FTF requirements are met, delay submission of the final claim until all face-to-face requirements and documentation is met. Learn more and check the description box below for a link to the FTF Encounters for Home Health Certification Education Sheet published by CGS Medicare. Learn more about documentation and coding requirements and consider obtaining your Certified Medical Documentation Professional or CMDP credential. Contact us today. I hope you enjoyed this coding and documentation tip.